Hello, everyone. My name is Melanie, and the event title that I have chosen to present on is Virginia Lawmakers Consider Proposal to Legalize Physician Assisted Death. So, in this article, the focus is on the state of Virginia, specifically wanting to legalize medical aid in dying. So, the article focuses on a woman named Barbara Green who was diagnosed with pancreatic cancer in the year of 2022. In the interview done with Barbara, she states that if she is legally able to make her own decisions on treatment, such as accepting or refusing chemotherapy, why can't she make decisions on how and when her death will be? So the term medical aid in dying was coined due to pushback on the idea of suicide. While these individuals who are choosing this route do not essentially want to die, due to their prognosis and their diagnosis, their quality of life is not something that they personally deem living. So, currently, medical aid in dying is legal in 10 states, including Maine, New Jersey, Vermont, New Mexico, Montana, Colorado, Oregon, Washington, California, and Hawaii. Medical aid in dying is heavily regulated, and patients must meet the following criteria in order to qualify. So, one of the first qualifications is the patient or the individual must be 18 years of age or older. The individual must reside in a state in which the practice is legal. The individual must have a prognosis of 6 months or less to live and have this confirmed by two separate physicians. The individual must be medically competent and able to make their own healthcare decisions. The individual must make multiple requests for the option of medical aid in dying. Two of these requests must be verbal and one must be in writing. And the two verbal requests must be separated by a certain amount of time based on the state in which they reside in. And lastly, the individual must be able to administer their own medication. So medical aid in dying essentially is done via administration of a medication that is provided by the physician, but the patient must be able to administer it. So this does not include a family member or, again, the physician themselves. Personally, this topic is very important to me in my profession because I have seen so many patients suffer and fall victim to their diseases. I personally work on a telemetry unit, and although I don't work on a non-oncology unit where I see much cancer, I do feel like in the last few years that I've been a nurse and working in an acute care setting, I have seen an increase in the number of patients coming in and being diagnosed with cancer. And unfortunately, the ages of these individuals that are being diagnosed with cancer, I feel like has become younger and younger, and their prognosis is not very good due to the staging of the cancer. Most of these people that I have seen, not all, but a very large amount of them, have been diagnosed with higher stages of cancer, stage 4, as opposed to lower stages of cancer, and their prognosis again is not very good. So, in the example of the article, Barbara Green was given a terminal diagnosis of 9 months to live. She defied these odds and lived an additional year and a half. The idea of allowing their patients to live and end their lives on their own terms and not have to endure the suffering that comes along with their terminal illness, while it is difficult for many to understand, I do believe it is within their right. The bioethical dilemma presented by the event is the threat to a patient's autonomy. According to Fowler, autonomy is a rational self-legislation, and patients should be free to act according to their own values and chosen plan. The provision that is relevant to this event is provision 1.4, the right to self-determination. Now, this provision groups autonomy, non-maleficence, and justice. And while some can argue that allowing the patient to have access to physician-assisted death goes against the idea of doing no harm to our patients, again, I present the idea that this would be the patient's choice, and it would allow them to choose the path of less suffering if they deem that is appropriate for them. The implication that this has on healthcare workers and healthcare professionals can be the turmoil it can cause when considering a healthcare professional's personal and moral values. For example, in most religions, specifically including individuals who follow Christianity, the idea of suicide is considered a mortal sin. The article does touch upon the idea that, again, they are now straying away from the idea or coining the term assisted suicide or physician assisted suicide due to the negative overtone that this has, and instead deeming to call it medical aid in dying. As a healthcare worker, I personally believe it is especially important for us to continue advocating for our patients and ensuring that they are granted that right to autonomy. So, thank you.